So, hello student, we will begin with the next part of the evaluation and management, and in this we are going to talk about hospital inpatient and observation care services. The code range is 99221 to 99239. So in this basically we must understand the concept of outpatient versus inpatient. What do you mean by outpatient? Outpatient are the people who receive the care or the hospital service and return home the same day, while the inpatient is the hospital patient who has been admitted to the hospital and stays in the hospital overnight, or you can say meet the set of clinical criteria. Now, if you see the code range, it is divided into the initial service for the hospital inpatient or observation care, and the code is 99221 to 99223, and then we have a subsequent service that is the code range is 99231 and 99233, and then we have a discharge service that is 99238 and 99239. I'm going to put them in one group. And then there is one more code range that is admission and discharge on the same day, and for which we have a code range 99234 to 99236. So just take a minute to just observe these codes, and then now we will go deeper into this. So let us understand few guidelines and the concept related to these codes. So for the patient designated admitted as an observation status in the hospital, it is not necessary that the patient be located in an observation area designated by the hospital. If such an area does exist in the hospital, like a separate unit in the hospital or in the ED department, this code may be utilized. So in short, what is observation status? It refers more as the type of the care being provided. See, for typically a short-term monitoring and assessment to decide whether the patient should be admitted as an inpatient or discharged rather than the specific physical location. So the patient may be in the designated area in the ED, or he may be in the hospital building on the hospital bed, but on his case paper it is written that the patient is under observation. So though physically he is inside the hospital, we cannot say he is inpatient, because on his paper it is written the patient is under observation status. This is a very important concept you must understand. And second is the total time on the date of encounter is by the calendar day. So when using the MDM or the total time for the code, selection a continuous service that spans the transition of the two calendar date is a single service and is reported on one calendar date. So for example, if the hospital admission starts on 10th of April and continues through April 11th, you would report the service on 10th of April, counting all the time spent on both the days. So these are very, very important concepts. You must understand them so that your guidelines will be clear, and then you will never make a mistake in solving the question. Now, when the patient is admitted to the hospital as an inpatient or to the observation status in the course of an encounter in another site of the service, for example, ED, or the office of the nursing facility, the service in the initial site may be separately reported. Modified 25 may be added to the other evaluation and management service to indicate a significant separately identifiable service by the same physician and the other qualified healthcare. So what does it mean? See, suppose if the patient comes to the office of the doctor, and the doctor is examining the patient, and suddenly the patient condition worsen, and then the doctor feels let's admit him into the hospital. So from the office they call the ambulance and shift the patient to the hospital. Now in this case what has happened is two things happened. He was having the office visit and then he went to the hospital. So in that case we are going to write two code, one for the office, second for the hospital, and then we are going to put a modified 25. And I mean, if it happens in the ED that the patient came in the ED and then was admitted also, the two place of service were there. One was the ED and second was the hospital. So in that case also we will write a modified 25. So this is very important. Second is, if the consultation is performed in anticipation of or related to an admission by another physician or other qualified healthcare profession, and then the same consultant perform an encounter once the patient is admitted by the other physician or other qualified healthcare professional, report the consultant inpatient encounter with appropriate subsequent care code. So what happens is, there is a consultant office. I'm trying to give the scenario for everything so that your understanding will be very good. So the consultant was checking the patient, and again the condition worsens, and then the consultant says ki, we need to admit him in the hospital. The patient goes to the hospital, another physician admit the patient in the hospital, and then consultant finishes all his patient in his office, and while home he decides, let's go and see the patient which has been admitted by me, admitted in the hospital. So that consultant visit in the hospital will be a subsequent care code. So that is very, very important. Then the next is, an initial service may be reported when the patient has not received any professional service from the physician or other qualified healthcare profession, or another physician or other qualified healthcare profession of the exact same specialty and subspecialty who belong to the same group practice during the stay. So since we saw the code initial care and subsequent care, so the initial care is basically the first service. The initial service, first service, that is given by given by the professional, and that is counted as a initial service. Then the next is, when advanced practice nurses or physician assistants are working with the physician, they are considered as a working in the exact same specialty and subspecialty as the physician. So suppose if the doctor is a cardiologist, the nurses who are working in under him are also of the same specialty. And for the purpose of reporting an initial hospital and inpatient or observation care services, a transition from the observation level to the inpatient does not constitute the new stay. This is also very important. So suppose the patient was under observation and his condition worsens, and they say ki, now we need to admit him in the hospital, and so then that stay is considered the same stay. So these are all very important guidelines, and in the next slide I have just highlighted the important thing from all the guidelines. But I always feel that one should read the guideline the way it has been given in the your book, and then we can have the just the bold points. So whatever the bold point, whatever the guidelines I have explained in the previous two slides, I have just given the bold points. They will help you to just go through all the guidelines once again. Kindly take a minute to read all the guidelines, or just understand them again further, and then we can go to the next slide. Now, I want you to take some time just to understand the code. So this is the initial hospital inpatient or observation care. The codes are 99221, 222 and 223. While these are the subsequent hospital inpatient observation care. Now, there are two important key points is to remember that when coding for the hospital and inpatient and outpatient setting, there is no distinction between the new and established patient in the hospital and outpatient facility coding. And secondly, the minimal medical decision making is not requirement for the selecting the code in this setting. Low and straightforward MDM is stated by the same code. So you can see that 99221, we have a straightforward or low level of medical decision making. So we have only three codes. If you remember, in the office we used to have 4 or 5 codes, because there were 4 level of medical decision making: straightforward, low, moderate and high. But in this case, the straightforward and low is represented by one code, and there is no distinction between the new and established patient. So these are the charts which are there in your book, and you can see here that the patient new or established, no distinction, And another important thing that you will see that every code is a time bound. So the times are written below every code. So we will have to take that into consideration whenever we are solving a particular question. Now the next code, I'm slightly going to jump and I'm going to take the code for the hospital inpatient or observation discharge services. These codes are 99238 and 99239. These are also the time-based service used for the hospital discharge day management. And in this case, 99238 is reported when 30 minutes or less is spent on the discharge activities, while 99239 is used when more than 30 minutes is used in the documentation. So these are the code for that, and these are the hospital or the observation discharge services. Now let's look at the guideline. The hospital inpatient or observation discharge day management codes are to be used to report the total duration of the time on the date of encounter spent by the physician or other qualified healthcare professional for the final hospital or observation discharge of the patient, even if the time spent by the physician or other qualified healthcare profession on that day is not continuous. The code include as appropriate final examination of the patient, discussion of the hospital stay, instruction for continuing the care, all relevant caregiver to all relevant caregivers, and preparation of the discharge record. So in this case, what happens is many a time, suppose for example, the doctor is preparing a discharge, he is giving all the instruction, he is telling all the medications and everything, and he is attending that discharge and he has spent 15 minutes, and suddenly there some emergency comes, he leaves this patient and goes and attend that emergency, and then he comes back and then he spent another 15 minutes for this patient. So how will I calculate the first 15 minutes for this patient and then the next 15 minutes? In between the 30 minutes he went out and to attend the emergency, that time is not counted. Whatever the time he has spent with that patient, discharging him is his time, and it wasn't continuous because he started, he spent 15 minutes, in between he left, he again came back. So I'll be counting 30 minutes because 15 plus 15, okay. And then the next is this discharge code 99238 and 239 are to be used by the physician or other qualified healthcare professional who is responsible for the discharge service. So there are particular doctors. Doctor means the doctor, usually it is like that if I have admitted the patient, I will see whether I have to discharge the patient. So I am responsible for the discharge. Services by the other physician or other qualified healthcare professional that may include the instruction to the patient and or family or caregiver, and coordination of the post-discharge services may be reported by 99231, 232 and 233. So what are these codes? These are the subsequent care code. So if the service is not given by the doctor who was supposed to carry out the discharge, then we will write the subsequent care code, not the discharge code. Very important guideline. So again, the quick recap of the guidelines which I have explained in detail in the previous slide. Kindly go through that so that it will help you to kind of understand the guideline better. So now the next slide is hospital inpatient or observation care services, including admission and discharge services. What does it mean? So we have the code 99234, 99235 and 236. These are the code we will use it in this scenario. What is this scenario? The following codes are used to report the hospital inpatient or observation care services provided to the patient admitted and discharged on the same date of service. So in same date, admission also happened and discharge also happened. Okay. Because for the patient admitted to the hospital inpatient or observation care and discharged on a different date, we were using the code 99221 till 99239, and out of that, this was for the initial day, this was for the subsequent day, and this was for the discharge. But if it is admission and discharge, that means we are talking about the two encounters on the same day, of which one of these encounter is a initial admission encounter, and another encounter is being the discharge encounter. So that time we are going to use this code. So like for example, the patient was admitted into the observation status, and his condition then become normal, and then he is absolutely fine, and the doctor decides okay, now there is no need to keep him in the hospital, doctor discharge the patient. So he came in the morning, he was admitted, by evening or afternoon he was discharged. So the same day both the things happened, he was admitted and he was discharged. So for that we are using this code. Now remember, for the admission and discharge on the same day, for the code 99234 and 235 and 236, there is a duration requirement. So more than 8-hour rules. What is this rule? If the patient is admitted and discharged on the same day, the total duration of the care must be more than 8 hours to report the admission and discharge services code. For the patient stay less than 8 hours, what do? For the patient, hospital inpatient or observation care lasting less than 8 hours, report only the initial hospital inpatient or observation care codes, that is 99221, 222 and 223. Do not use the discharge day management code. Okay, this is very, very important. And this is a very nice table which is given in your book, and it talks about less than 8 hours, same calendar date. So here pay attention, calendar date. Then we write the code 221, 222, 223, because the stay is less than 8 hours. If the stay is 8 or more hours, then we can write this code. These are the admission and discharge on the same day. Again, the stay less than 8 hours, different calendar date, we will write this code. That is 99221, 222 and 223. Stay 8 or more hours, the different calendar date, then we are writing this code. So this is a very, very important table. Pay attention, go through this, and go through this particular thing again. So again, this is a snapshot of all the guidelines, and this is the table which is the admission and discharge on the same day. We have the 3 levels of MDM there also, and all these are the time-bound code. Now let us take some questions. A patient present to the emergency department with abdominal pain at 7:30 a.m. The patient is examined, and after the series of diagnostic tests, a high MDM rendered. The patient is admitted to the observation status for the further evaluation and monitoring. During the observation period, the following diagnostic tests were ordered: blood work, CT scan and ultrasound to rule out any serious condition. A medically appropriate exam was carried out with the moderate medical decision making, and the ED physician rendered a diagnosis of the gastritis. Which of the following best describe the encounter? Now have a look at your options. Now what has happened here? Here the patient was in the ED, and then he was admitted to the observation status. So the place of service was from ED to observation status. And we have a guideline that if the patient is admitted to the hospital and has been seen in another site of the service, for example, office, ED, nursing facility, the other visit may be coded by using the modified 25. So that easily eliminate option B and C. Now we are left with our option A and D. Now the first code is the emergency department code. We will put a modifier on that, and now we have this code 99222 and 99236. What is 99222? This is the what is it? It is the initial service. And what is this 99236? This is for the subsequent service. So let us see what's the answer. So answer is the correct answer. The first code is for the ED. We put the modifier, and in between 99222 and 236, this is for the initial day and this is for the subsequent day. So we are going to code for the observation status moderate MDM. And why we are not taking subsequent? Because the ED and observation status, they are not the same location, because the observation status and the hospital, yes, we can consider, but this is the different location. So we will be going with the 99222 and look for the MDM, that is moderate. A patient, John Davis, involved in a motor vehicle accident the week prior, sustained bilateral fracture femurs. Anxious to discharge, John asked the nurse to request that his physician expedited his discharge or he would leave on his own violation. The discharge physician was doing rounds and was unavailable at the time of request. However, the colleague from another practice already on the floor agreed to carry out the discharge. The total time spent performing the discharge service was 40 minutes. Let's look at the code. If you see the code, these are the two discharge code. What is this code? This is the admission and discharge on the same day. And what is this? This is the subsequent care service. What is our guideline? The doctors or the qualified healthcare professional not responsible for the discharging use the subsequent hospital code. Now, in this scenario, what has happened? His discharging physician was doing round and was not available, and that doctor requests his colleague to carry out the discharge. So that means somebody else has carried out the discharge who is not responsible actually for the discharge, because his actual doctor or the regular doctor was busy somewhere else. So that will give a clue, and now so we cannot write the discharge codes, and now we'll see what's the answer. So we definitely cannot write 99239 and 238 because those are the discharge code. 99234 is admission and discharge on the same day. That didn't happen with the patient. And 99232 is for the subsequent care code, and that is what has happened here because the another physician carried out the discharge. And if we see the time limit is 40 minutes, our rule is it should meet or exceed, and that's why 99232 is the correct answer. Now let's take the next example. Mrs. Johnson, a 65-year-old female, presented to the hospital at 2 p.m. with a complaint of weakness, dizziness, and decreased urine output for the past 24 hours. Dr. Xavier evaluated the patient. She reports feeling lethargic, experiencing a dark concentrated urine. No significant diarrhea, vomiting, or other symptoms were reported. The patient appears weak but alert. Labs ordered, including complete blood count, CBC, electrolyte panel, and the renal function test. Urine analysis performed, indicating the concentrated urine. Diagnosis: mild dehydration due to insufficient fluid intake. Patient educated on the importance of fluid intake and sign of dehydration. Dr. Xavier admitted the patient for rehydration therapy for 1 hour. The IV access established and normal saline started. Upon completion of normal saline drip, patient was discharged home 6 p.m. on the same day. Both admission and discharge took place in the single encounter. What's E&M code is reported for Dr. Xavier's service, and let us see what are the options. Always remember that kindly just understand the code. So if you see the code 99234, this is the code for the observation and discharge, sorry, admission and discharge on the same day. Now, when 99234 is also admission and discharge, and this is discharge code. This is not the way we write the code. So this is the writing itself is wrong. So we are going to eliminate the option B. Now option C is 99221 and 99238. So this is the initial service and this is a discharge. And D is 99222, that is a initial service. Now in this case, the admission and discharge happened on the same day. So we have to look for the code. But wait, there is a guideline for the time. Time duration has to be 8 hours. Now let us see what is our time duration for in this encounter. She was admitted in the hospital at 2 p.m. and she was discharged at, when was she discharged? She was discharged at 6 p.m. What is the time? 2 to 6 is basically 4 hours. So is she meeting the criteria of 8 hours or more? Because we have the table here. So it is less than 8 hours and same calendar date. So can I write the admission and discharge code? No, we will have to take care of this code. So we are going to take care of this code and let us see what our answer is now. So our answer is D 99222. That is the code which we are going to see. And if you see the amount of number of the test and then the overall situation, it is the correct code because it is a moderate MDM, and we will zero down that code. Let us take the next question. A 34-year-old male was admitted to the hospital on 18th of December from the ER following the motor vehicle accident. His spleen was severely damaged and a splenectomy was performed. The patient is being discharged from the hospital on 21st of December. During his hospitalization, the patient experienced a pain and shortness of breath, but with an antibiotic regime of Livaquine, he improved. The attending provider performed a final examination and reviewed the chest X-ray and revealing possible infiltrate and CT of the abdomen, rule out any abscess. He was given the prescription of Zovacin. The patient was told to follow up with his PCP or return to ER for any pain or bleeding. The provider spent 40 minutes on the date of discharge. What CPT code is reported for the 21st December? Now here he was admitted on 18. From where he was admitted? From the ER, admitted to the hospital from the ER. Okay, so that is one important thing, and we are told to code for the 21st December. What happened on 21st December? 21st December discharge happened. So we are told to only code for the 21st December. So remember, and who has done the discharge? So let us see that, because that is also one important criteria, because for the discharge, the the doctor who is responsible for the discharge should carry out that discharge. So there is a statement here: the attending provider perform a final examination and review the chest X-ray, revealing possible infiltrate, CT abdomen, rule out any abscess, and he carried out the discharge. So we have enough data for us. Now let's take quickly, let's see all the options. 99223 is for the subsequent, 99231 is for the again the subsequent day and the discharge. 99238 is for the discharge and 99239 is for the discharge. And the question is very clear that what CPT code is reported for the 21st 12 December visit. Okay, so now we will see what's the answer. So since we have been told to code for only the discharge date, the discharge was carried out by the attending provider, and remember the discharge codes are the time bound code, and below 30 minutes we will code 99238, but if it is above 30 minutes we will code 99239, and that's why our answer is D. Let us take the next question. Question number 5. Dr. Jones documented Mrs. Smith's condition has improved during his third visit to her hospital room. Upon entering the room, he finds her sitting up in the bed watching television and eating breakfast. Dr. Jones performs a problem focus exam and low medical decision making. What ENM code is reported for this visit? So we have been told to code for this visit. And what is this? This is the third visit. And we know that the first visit is the initial care, and each visit after that will be the subsequent care, and this is his third visit. So we have enough information. Quickly check the code. So in this case, this is the 99231 is the code for the subsequent care. 99221 is the code for the initial care. 99233 is also the code for the subsequent care, and 99234 is the code for the admission and discharge. Okay, so let us see what's the answer. No, yes, 99231 is the answer. And why we are not taking the answer 99233? What is that one note which is helping me to zero down this answer? And yes, you are very right. The answer, it is low medical decision making, and we know that the straightforward and the low medical decision making has the first code 99231. So very right. Dr. Allen, a 48-year-old patient, presented to Dr. John's office with a complaint of fever, malaise, chills, chest pain, and severe coughs. Dr. John took a history, did an exam, and ordered the chest X-ray. After reviewing the X-ray, Dr. John admitted Allen to the hospital for the treatment of pneumonia. He spent 52 minutes for this service. After his regular office hours, Dr. John visited Alan in the hospital where he dictated decision making of moderate complexity. How would you report Dr. John's service? So let us take our data from the given encounter. What has happened is the patient has gone to Dr. John's office and then he was admitted to the hospital. So the place of service was office and hospital, and when we have this kind of scenario, we will always require two codes. That will eliminate option A and D, and between B and C, we will have to zero down our answer. So let us see what our answer is. So our answer is C, where 99204 and the modified 25, because we will require a modified 25 for the office visit, and then we will put the initial hospital care, that is 99222. And why we are choosing 99222 is because the MDM is of the moderate complexity. And remember an important guideline that we never put the modifier 51 on the ENM code. This is very important because that will help you to eliminate many wrong answers. So let us take the next example. The patient is seen today. She has been transferred from the observation to the floor. This is my first time visiting the patient since transferring from the observation. She has essentially stabilized. She was having some type of seizure activity during the visit. Physical examination. Her vitals overall are fairly well stabilized. Her post-operative dressing are in place. She did have a significantly elevated INR, so the dressing have been kept in a place to minimize the risk of bleeding. She was sleeping, so I did not wake her up. Her toes are pink and warm and calves are soft. So, impression is seizure, status post left hip bipolar, hemiarthroplasty. Plan I will continue to follow. From my standpoint, she can mobilize and weight bear as tolerated on the left side. We will change her dressing and place a TED hose on the left leg. We will continue to follow her INR and hemoglobin. The total time of encounter is 30 minutes, which code best describe the encounter. Now in this case what has happened is patient has been transferred from the observation to the floor, and there is a very important guideline that for the purpose of reporting an initial hospital inpatient or observation care service, transition from the observation level to the inpatient does not constitute a new stay. So this is the from observation to inpatient. When she has gone, the stay is considered the same stay, and that is very important guideline. And now we will see on the code. So in this case what has happened is she here this is my first time visiting the patient since transferring from the observation. That is very important thing. Now we have this guideline and we have the encounter. So just see the code. So 99232 is the code for what? It is the subsequent code. Now 99221, it is the initial day. 99231 is also the subsequent, and 99221 is also initial. So we have two initial care and two subsequent care. Now we need to find out which is the correct code, and for that, since the time the time is given but MDM is not given, and time is sufficient for us to zero down the code. The patient was moved from observation to the hospital, which is not the new stay, so that we have to take into consideration. And so we will have the code subsequent and initial. We will look for the subsequent because this is doctor visit. Again, when the patient is moved to the hospital, and whenever we are zero down in the code, we will look for the MDM or the time. MDM is not given, the time is given. And if you see the code 99231 and 99232, 231 corresponds to 25 minutes and the 232 correspond to 35 minutes. And we have a chance that it should meet or exceed. And in our case, 231 is, that's why the correct observation status from for chest pain. to rule out angina. The cardiologists perform a comprehensive examination and decision making of moderate complexity. Her chest pain has been relieved with a nitroglycerin drip given before admission, and she would like to go home. Doctor has written prescription to add to her regime. He has given her isosorboid and she is tolerating it well, hence decided to send her home. We will follow up with her in the week. Patient was discharged on the same date of service at 7 p.m. What CPT code is reported? So in a day, there are two encounters happen. The admission happened at 10 a.m. and the discharge happened at 7 p.m. So can we put the admission and discharge code? Yes or no? Because there is one more important guideline there, that the duration, time duration is also important, because if it is more than 8 hours, then only we will consider of putting the admission and discharge code. So just count the time between the 10 and say 10 to 7, and then we will zero down our answer. So yes, the time was 9 hours. So we can definitely use the admission and discharge code. And if you see the code, this is the code for the discharge. This is also code for the discharge, and this is the initial care code. So 99235 is the discharge code, and that we will put it. So this is a case report. Let's pay attention. Dr. Jain admitted 67-year-old woman to the coronary care for an acute myocardial infarction. The admission includes the high complexity decision making. Dr. Jain visited the patient on days 2 and 3 and documented each day. A decision making is of moderate complexity. On day 4, Dr. Jain moved the patient to the medical floor and documented straightforward decision making. Day 5, Dr. Jain discharged the patient to home. The discharge took over an hour. How would you report the services from the day 1 to day 5? Okay. Now this is very important. First of all, let us see all the options. Now there are multiple codes. So if one code is also wrong, that option is wrong. 99213 is an established patient. First of all, I established patient office visit. Here there is no mention of the word office visit. So I will not require that code. And secondly, 99239 multiplied by 2, I never write. Okay, so option A is wrong. Now we have left with option B, C and D. Now what is the discharge time? It is over an hour. And if you remember that the discharge codes are time bound, up to 30 minutes we write 99238 and over 30 minutes we write 99239. So we will definitely require code 99239. So that will eliminate option B. And even the option C is also not correct, because again here there is a code 9921799. So now we will see the option D and what is the correct answer. Yes, so the correct option is option D, and here is the explanation. We are counting for 5 days 1, 2, 3, 4, and 5, and here for every day the medical decision making changes, because initially it was of the high complexity, then on the day 2 and day 3 it becomes a moderate complexity, and this is for the subsequent care, and then again this is for the day 4, but here the medical decision making becomes a straightforward, and this is the day 5 where the discharge happens, and the discharge took over an hour, so we will require a code 99239.